let us go on to the next part of the practical about forms and documentation. When you are requesting a blood group of a patient, you have to fill a normal request form as you would for full blood count or blood picture, a normal full blood count, and send it with a plain tube, send blood in a plain tube to the blood bank, and you will get the report on a form like this. The patient's name, BHD, ward, hospital, and the blood group will be mentioned. So, you fill in a normal request form and send it with a plain tube of 2 cc of blood, and you will receive the blood report on a form such as this. When you are sending blood for DT, direct test or compatibility testing, you send a form requesting for red cells like this. You fill this form, the request for red cells, and you send a plain tube again with 2 cc of blood. At the blood bank, they will perform compatibility testing with the patient's blood and several packs of red cells, and they will send you a compatibility report such as this, mentioning the patient details and the donor packs which are compatible with your patient. This will be fixed to your patient's BHD, and when you need the blood, you have to send the compatibility report back to the blood bank, and they will release you the necessary, the relevant blood pack. When you are requesting for platelets or plasma components, you have to fill in this form and send it to the blood bank, and because there is no compatibility testing for platelets or plasma done, but only group compatibility is done, you must make sure that the patient's blood group has been done prior to this and that the blood group report is available in the BHD. If an adverse reaction occurs when you are giving blood or platelets or plasma, you have to make sure that you fill in an adverse event form such as this and send it back to the blood bank with the blood pack which was responsible for the reaction, 2 ml of EDTA blood and 5 to 7 ml of plain blood. You have to make sure that you always report adverse events back by filling out this form. That is all for forms related to transfusion medicine.